Hi, I'm the Ostomy Nurse, sharing tips, tricks, and evidence-based information. Today we're talking about stomal prolapse. Prolapse describes the telescoping of the intestine through the abdominal stoma. It occurs most commonly in loop colostomies and more frequently in children than adults. Prolapse can be caused by increased abdominal pressure, obesity, a large opening in the abdominal wall that was created when the stoma was made, and if the stoma was placed outside of the rectus muscle. Presentation of a prolapsed stoma varies widely. Sometimes just a little bit of intestine telescopes through, sometimes it can go to up to a foot. You can reduce your stoma, meaning that the telescoping part retracts back into your body by reducing your intra-abdominal pressure. It's important to note that the length of the prolapse is directly correlated to the number and severity of complications. The longer that prolapsed intestine is, the more likely you are to have an edematous or swollen stoma, as well as a stoma complicated by trauma and ischemia or limited blood flow. Ischemic stomas look dusky and require urgent surgical intervention. If your stoma is prolapsing, you should be monitoring its color. It's very common for a prolapsed stoma to develop in conjunction with a peristomal hernia. If we think about the construction of a stoma, this makes a lot of sense. The surgeon has to cut through the abdominal wall muscles and fascia and pull part of that intestine through to create the stoma. This is inherently creating a hernia, a weakness in the wall. So it's more common for these stomas to prolapse through if that hole in the abdominal wall is larger. Some patients feel shame and anxiety about their prolapsed stoma and want it to be fixed immediately with surgery. However, generally conservative management is indicated. True treatment of prolapsed stoma requires surgery resiting the stoma, but that means that you're getting another abdominal surgery, another hole in your abdominal wall for the new stoma, and you're functionally creating two areas of weakness instead of just one. So unless your stoma is suffering from ischemia or other complications, conservative management is preferred over surgical treatment. Having